Although there have been a number of really important advances in terms of our understanding of the suicidal mind and the risk factors associated with suicidal behaviour and suicidal thinking, I think a number of key challenges remain. In this podcast, I plan to talk about three key research challenges which I think are important to address in the field. First, we need more research to distinguish between individuals who have thoughts of suicide but do not act on those thoughts, and we need to better understand how these individuals are different from those who translate thoughts into suicide attempts. Second, we need more empirical data, more empirical evidence to test the new theoretical models of suicidal risk. And third, we need more research on the terminology that we employ so we can agree a consensus on whether it is more beneficial to talk about self-harm as an overarching term, or whether the benefit is much greater in distinguishing between non-suicidal and suicidal behaviour. In other words, viewing these as dichotomous, distinct behaviours. First is this notion of the distinction between the factors associated with suicidal thinking and the factors associated with suicidal behaviour. And I think we need to move forward and employ more sophisticated research designs to try and better understand what differentiates those factors associated with suicidal thoughts and how they are different from the factors which determine whether you act on those thoughts. In other words, whether you engage in suicidal behaviour. And indeed, two of the recent psychological models, my model on the integrated motivational volitional model of suicide and Thomas Joiner's model, his interpersonal theory of suicide, both try and take this forward in respect of understanding, as Thomas talks about it, the distinction between suicidal desire and acquired capability. And indeed, I talk about the distinction between motivational factors and volitional factors. Motivational factors are factors which are concerned with the development of suicidal thinking or development of suicidal intent. And then volitional factors are those factors which distinguish an individual who only thinks about suicide from somebody who engages in suicidal behaviour. So the volitional factors are those factors which determine whether somebody acts on their thoughts. So I think in the next 12 months or more, we'll see a growth in research in this distinction, and distinction between suicidal thinking and suicidal behaviour. This is important theoretically for obvious reasons, but it's also really important from an intervention or prevention point of view. Because if somebody presents with suicidal thoughts, then what's crucial is to understand which individual with suicidal thoughts is more likely or less likely to act on their thoughts. So it's absolutely fundamentally important that we better understand this distinction. The challenge is this. Although the vast majority of people have a mental disorder at the time of death, most people with mental disorders do not take their own lives. And indeed, if we just focus on depression for a second, we know that the vast majority of people with depression do not end their own lives. Indeed, it's about 5% of people with depression who take their own lives. So one of the research challenges ahead is to better distinguish individuals, in this case, who have depression, who are suicidal, from those who have depression who are not suicidal. We need more sophisticated models of suicide. We need a better understanding of the complex interplay of factors, such that we can distinguish with some sensitivity and specificity the 95% of people with depression who do not take their own lives from the 5% of people with depression who do. I've only focused on depression here. This sort of dichotomy exists for a whole range of other factors. So one of the big challenges as we move forward is, in this more sophisticated understanding, we need to identify what I talk about as more individually sensitive markers of suicidal risk. They could be psychological markers, they could be social factors, they could be cultural factors. The point is, we're not sufficiently advanced in our thinking or in our research in understanding the suicidal mind. So key challenge for the next 12 months and beyond is to really address this key question of whether self-injurious behaviour is better conceptualized as a dichotomy, in other words, suicidal versus non-suicidal behaviour? Or is it better represented or better operationalized as this broad heterogeneous domain called self-harm, which has different motives, sometimes suicidal, and has different methods? Although there have been studies which have dichotomized individuals according to their self-injurious behaviour into suicidal versus non-suicidal behaviour groups, and then investigated potential differences between these two groups, and indeed in some cases have found some differences between the two groups, I do not think this provides sufficient evidence to support a dichotomous view. It still is consistent with, in some cases, a continuum approach. So what I would argue is we need much more research in this area. We need to employ different research designs. We need to employ larger scale studies. We need to ensure that we recruit individuals from a range of different backgrounds across the lifespan and employing a whole range of self-injurious behaviour methods. Only by pulling this data, by employing these different approaches, will we be better placed to make the judgment on whether suicidality or self-injurious behaviour more generally is better conceptualized as a dichotomy in terms of suicidal behaviour on the one hand and non-suicidal behaviour on the other, or this approach which is consistent with the UK view, which is the self-harm idea, where we talk then about different motives which underpin self-harm and different methods and different potential lethalities. Only when we conduct this research will we be better placed to make this judgment on what is the best way forward for the field. If you're interested in more information on the non-suicidal versus attempted suicide debate, with colleagues elsewhere in the UK, we have written about this recently in the British Journal of Psychiatry. It's also worth noting that earlier I talked about the UK perspective on self-harm. It's important to note that this represents the view of many people who work in the area in the UK, but needless to say, not everybody.